Hi, my name is Teresa. I've washed my hands and I'm going to be doing a head to toe assessment on you today, okay? All right. We are going to do your vital signs, so we'll do the blood pressure, your pulse, respirations, and your pulse ox, okay? After we do that, then we're going to assess your hair, skin, and nails, and we're just going to go on down from there, okay? And I'll let you know what we're doing. Okay, so I'm just going to look at your head, okay? All right. No masses or lumps or any problems up here, huh? All right. Hair's smooth, evenly distributed up there. All right. And your skin, look at your face here. Everything looks good, pink, smooth. Look at your nails here. Yeah, they look good. All right. Any rashes or anything anywhere that you've noticed? Okay. Everything looks great. All right. Now I'm just going to kind of look at your face and work my way down, okay? All right. What I want you to do for me is just clench your teeth for me, and I'm going to feel your temporal muscles up here and your masseter muscles here. All right, and those are strong, and that's your trigeminal and your facial cranial nerve. Okay, that's 5 and 7. All right, so now I'm going to look at your eyes here. Your eyebrows are evenly distributed and full. Your eyelashes look full, evenly distributed. All right, open your eyes. Eyelids look good. All right, your sclera is white. Conjunctivus pink. Okay. Any eye problems that you've had at all lately? Nothing like that? Okay. All right. We're going to do her optic, ocular, trochlear, and abducens. 2, 3, 4, and 6 cranial nerves here and test them. So I'm going to first look into your eyes here. All right, at your fundus. I'm going to shine this light in here. You'll just kind of look over my shoulder. Okay. All right. Alright, red reflex is present there. And red reflex is present there. Alright, and your pupils are reactive to light, round, and they go from 2 to 4. 4 to 2. Alright, okay, now let's see here. We're going to go to your ears, okay? Let me get this thing. Oh, yeah. First of all, let's get back for a second. Okay. I'm going to have you read this, okay? It's called the Snellen test, and we're going to test your, this is kind of test your optic nerve, okay? All right, and I'll hold this up, and you just read these letters for me.
E, 3, B, F, 4, and G.
Okay, good. All right. Now then, this pen right here, I'm going to follow it to your nose, and you just follow it with your eyes, okay? Perfect. Now, I'm going to go this way with it and this way, and just look straight ahead and make sure that you can still see it in your visual field, okay? All right.
I did.
Okay, good. All right. Now, we'll go to your ears. So, for your ears, let me change my little thing out here for you. All right. First, I'm just going to feel on your auriculars here. No tenderness or masses or anything like that. Check your tragus here. Does it feel okay? Your mastoid right here behind your ear. No masses or anything there. Okay. Now I'm going to look into your ears at your tympanic membrane.
Okay.
I'm going to kind of pull up here on your auricular. Look in there. All right. It's intact. Grayish in color. All right. And that one's intact and grayish in color. All right, now what I'm going to do is a whisper test for you, okay? So I'm going to whisper a combination of 3 letters and numbers, and I'm going to see if you can repeat it for me, okay? And I'll include one of your ears, and we'll test your right one first, okay? Okay.
AR1.
Okay. I'll include this one now.
OU1.
Okay. All right, and that tests your acoustic, which is number 8. Now we're going to do something called a Weber and Rhine test, okay? And I'm going to, this is a tuning fork. We'll make it vibrate. I'll place it on the top of your head. You let me know if you can hear it in each of your ears or how, okay?
I can hear it.
Okay.
Both ears.
All right, and that's the Weber test. Now we're going to do the Rhine test, okay? I'm going to make it vibrate, and I'm going to put it on your mastoid here. Okay. You can hear it both your ears? Okay.
Yes.
Tell me when you can't hear it anymore. Okay, and I'm going to place it beside your ear. Can you hear it in your ears now? Okay. All right. Now we're going to do, I'm going to look in your nose here, okay?
Okay.
No drainage, anything like that
None.
going on. All right, let me look up in here. All right, mucosa's pink. No deviated septum noted there. I'm going to test your frontal and your maxillary sinuses here, okay? I'm just going to apply some pressure to them. These are your frontal ones. And then your maxillary. Does that feel okay? All right. Okay. Now then, this is cranial nerve number 1, which is your olfactory. And I'm going to have you smell something, okay? I want you to close your eyes,
Okay.
occlude one of your nares, and tell me if you can smell something.
I do.
Okay? And then do the other one. Include the next one. Okay?
I do.
All right. What were you?
Menthol.
Menthol. Okay, good. All right. Now I'm going to look in your mouth, okay?
Okay.
All right. When we look in your mouth, I'm going to have you say, ah, okay? And I'm going to look at your palate, up or lower, stick your tongue out, and we're going to assess all that and look at your teeth,
Okay.
okay? During this one, we're going to check for cranial nerves 9, 10, and 12, okay?
Okay.
Which is glossopharyngeal, vagus, and your hypoglossal, okay? All right, so open up and say ah for me. All right, and there's palate rise, and let me look under your tongue. All right, and then, all right, stick your tongue out for me. All right, teeth are all white. All right, nothing, no problems in your mouth, no ulcers, nothing like that.
No.
All right, okay. Let's see here. Okay. So now I'm going to put some little, I'm going to touch your neck, okay, here. We're going to assess your lymph nodes and your trachea and your thyroid, okay? All right, so we'll start with your lymph nodes, okay? This one is preauricular here, okay? Then we're going to go to a posterior auricular, which is right behind your ears, okay? And then we got occipital, tonsillar, submandibular, and submental. All right, then we're going to come down your neck here. We got superficial cervical, posterior cervical, your deep cervical chain, and your supraclavicular. All right, and they all feel soft and mobile. Any pain or tenderness there?
No.
Okay, now I'm going to look at your trachea here. Swallow for me too. Okay, trachea is midline. Now I'm going to assess I'm going to feel your thyroid here, and then I'll come around back and kind of feel it too, okay? Just checking for any enlargement in it. Okay. All right. All right, let's see here. Now, I'm going to move down to your chest, okay? During this, we would do your breast assessment and axillary assessment. When we did your breast assessment, I would have you have your arms down by your sides, and then you place your arms over your head or your hands on your hips when we did all your assessment, okay? It's just different levels. Have you noticed any lumps or anything like that in your breast, any tenderness, nothing like that? Okay. When doing the breast exam, you would start on the side by the axilla, and you go in an up and down motion or a vertical strip, and you make your way from the axilla all the way across the breast to the sternum on each side. Check the nipple for tenderness or any discharge. Hold it between your index finger and thumb and kind of apply some pressure there. All right. When you check your axilla, I would put my fingers up into the highest point of the apex, press in towards the chest, and then make my way down. All right. Now let's see. You can lay down for me.
Okay.
And I'm going to listen to your. You know what? Let me listen to your back.
Surely,
first.
surely. No problem.
We're going to listen to your lung sounds first, okay?
okay.
And I'm going to come around to your
Okay.
back and just into areas here. All right. I'm going to listen over full inspiration and expiration. Breathe in and breathe out. Okay, good. Breathe in and breathe out. All right. Breathe in and breathe out. Breathe in and breathe out. Okay. Now I'm going to percuss on your lungs here, okay? All right, percussion is resonant, and lung sounds were vesicular. Then we're going to do this thing called tactile fremitus that I'm going to assess for, okay?
Okay.
So I'm going to put my hands on your lower back down here,
Okay.
and I want you to say 99.
99,
Okay, again.
99.
All right. Okay. Now, then, did that. Now what I'm going to do is check your pulses, okay? So I'm going to check your pulse right here first. This is your radial pulse. Good. Brachial. Okay. This radial and brachial. Okay. Then I'm going to do your popliteal pulse here. In here. Dorsalis pedis pulse. And your posterior tib pulse. Okay, pulses are strong. 2+. Okay, when you lay down, I'll check your femoral pulse, okay? It'll be
Alright.
easier for me to get to it when
Alright.
you're laying down. All right. Okay, good. Now I'm going to listen to your heart sounds, okay? I'm going
Okay.
to listen to it over the aorta.
Mhm.
Pulmonic. Mitral. And tricuspid areas. Now listen to it with the bell also over each area. Okay. Your heart rate's normal rhythm, and S1 and S2 is present and crisp.
Good.
Okay.
Good.
Right now, too, while you're laying down, I'll go ahead and check your carotid pulse too, and listen to your carotids.
Mhm.
Okay. Okay. All right. Now I'm going to place the bell over your carotid arteries, and I'm going to listen. Okay. And we're going to do, whenever I'm listening on one, I want you to hold your breath. Okay.
Okay.
All right, here we go. Hold your breath for me. Okay, you can breathe. Okay, hold your breath one more time. Okay, and you can breathe. All right, no bruits are noted. All right, so now we're going to go to your abdomen, okay? So I'm going to listen in all 4 quadrants. Okay. Vowel sounds are active in all 4 quadrants and present. All right, now I'm going to percuss here, okay? All right, kind of dull there. Also, I'm going to feel around here. Let me know if you have any pain or anything. Does everything feel okay?
No pain.
All right. Okay, let's see here. Let me test your capillary refill too. All right, capillary refill is brisk. Okay, let's see here. Now we're going to go on to, okay, I'm gonna have you stand up for me.
Okay.
Come over here. And then if you will just walk this way for me. And I'm just gonna watch your gait here. Okay, and turn around and walk back. Okay, that looks good. No swelling or edema in
None.
your arms, legs, ankles, nothing like that. Okay, and then I would assess for any varicose veins or anything in your legs, nothing like that. Okay. While you're standing up, we're going to test some of your range of motions, okay?
Okay, good.
And before that, let's do this. We're going to test your cranial nerve, number 9.
Mhm.
Let me look if that's the number I want to test here. it's your accessory. It's number 11. Okay,
Mhm,
spinal
mhm,
accessory.
mhm.
So what you're gonna do is, what I want you to do is just shrug your shoulders. Okay, one more time, shrug them. Okay, that's good. All right, so now we're going to do your range of motion of your spine, okay? So I want you to bend over and act like you're gonna touch your toes, okay? All right, and stand back up and kind of bend back more. Okay, that's flexion and extension, okay? Then I want you to rotate. Kind of turn to your right and your left. No pain there?
No.
All right, that's rotation. Then I want you to bend to your sides. One, that's lateral bending, okay? Everything moves good there?
Yeah.
No problems. Okay, we're gonna do your shoulders now, okay? So what I want you to do is extend your arms up,
Okay.
all right? Flex them back.
Way back.
Flexion and extension. Yep, okay. Put them back down by your sides. Then we're gonna bring them out, okay? That's abduction. Then you're gonna bring them back to your sides for adduction, okay?
Mhm.
Good. Okay, now we're going to put your hands behind your head like this.
Mhm.
Uh-huh. All right, and then that's external rotation, and then bring them back, and that's internal rotation. All right, good. Okay, now what I want you to do is let's do your elbows.
Okay.
All right, flexion, extension,
Mhm.
supination, pronation. All right, good. Now your wrists. Okay,
Okay.
I want you to. That's flexion, extension, abduction, and adduction. Perfect. Okay. Now if you'll lay back, well, what I want you to do
Okay.
first before you lay back down is we're going to do your knees, okay? Can you just
Okay.
squat for me a
I
little bit?
can.
And I'll hold you. Perfect. And back up. That's
Mhm.
flexion and extension. Okay, good. All right. Now I want you to lay down in this bed here for me. Yep, we're going to do your hips. Okay? What I'm going to do is bring your leg up to your chest and back down. This one. Flexion and extension of the hips. Now, what I want to do is lean this leg off the bed, okay, and back down, and this one off the bed, and back down, okay? That is abduction and adduction of the hips, all right? And then we're just kind of roll this leg out, and then roll it back in, and roll this one out and back in. That's internal and external rotation of the hips. With the knees, you would just kind of rotate your legs down here, inward and outward. Inward and outward with the knees, okay? We're coming down here to the ankles and the feet. I want you to press your toes towards the ground. Okay, that's plantar flexion, and then up towards the ceiling, dorsiflexion. Okay, heel in. Okay, that's inversion, and then out, eversion. Okay, all right, that looks good. All right. Oh, let's test your grip real quick. Okay,
Okay.
I gotta test your strength. So, can you squeeze my fingers? Good. Squeeze them on this one. All right. Now, I want you to hold your hands up, and I want you to press up against my hand here.
Okay.
All right? So press up towards me. Good. Now press down. Okay, let's do the same one over here. Press down on my hand, and then press up against me. Okay, we're going to do the same with your legs. Okay, press up against my hand here with your leg. Okay, and then press down. All right, up here. Press up. All right, press down. Good. Okay. All right, we're done. We're finished with
Okay.
your exam.
Thank you.
You're welcome.